A sharp spike in the number of children testing positive for COVID-19 in the U.S., raising some new concerns about the upcoming holidays. And here to explain is Dr. Kristen Moffitt, an infectious disease specialist at Boston Children's Hospital. Good to see you.
Good to see you too, Emily.
So let's dig into this. The American Academy of Pediatrics saying there's been a 23% increase just since Thanksgiving in new COVID cases in kids. What does that tell you about the risk for infections in our households, especially during the holidays?
Yeah, data are pretty clear that many of the COVID-19 cases in children, particularly in young children who don't really do much independently outside of their household, are the result of transmission from an infected household member. So if anyone in the household is experiencing exposures or undertaking activities that put them at higher risk for exposure, particularly attending indoor gatherings without masks and without distancing with people outside of their household, then they're bringing that risk home. And the other thing that these numbers remind us of is that while children do tend to have more mild COVID-19 infection, children are accounting for more and more cases. So even those rare occurrences of more severe disease in a child, we may start to see more cases like that just as the numbers of cases in children continue to increase.
It's an important reminder just to be so careful. Let's talk about vaccines. The Pfizer option, that's approved for people over the age of 16. Are there teenage patients at Children's who should get that shot before other groups do?
Yeah, so the Massachusetts Department of Public Health website and other Massachusetts government websites have outlined the 3 phases of prioritization for vaccination in the state, with phase 1 including healthcare workers, first responders, and those who live in long-term care facilities or in congregate settings. That will be followed by phase 2, which will include people with underlying conditions that put them at risk for higher disease, for more severe disease, as well as essential workers. And that would be followed by phase 3, when the vaccine would be more broadly available to the general public. So it is certainly conceivable that if there was a 16 or a 17 or 18-year-old that met any of the conditions for phase 1 or phase 2, then they may well be prioritized for the vaccine before the general public.
So let's talk about the vaccine in kids. We know both Moderna and Pfizer are testing the vaccines on children. Do we know how these trials might be different than the ones run for adults? Are they using a smaller dose, or how would this be different?
So that is true. The trials from both Moderna and Pfizer in adolescents are already underway. And the biggest difference is that these trials are smaller than the adult phase 3 trials. They'll include a few thousand subjects instead of tens of thousands of subjects. But the dosing and the vaccine regimen is actually the same as what was used in the adult trials. And most likely, these trials in children will proceed into younger children if the adolescent trials show good safety data and show good immune data. And if that's the case, then the same dose and the same vaccine regimen would likely be moved into the next youngest tier of children. And that would likely continue unless they saw a safety signal, in which case they may need to be adapting either the dose or the regimen.
We've seen these very rare allergic reactions. 3, out of thousands. But is it possible that kids could be at a higher risk for any kind of allergic reaction?
Yeah, it's a great question, but not necessarily. There isn't anything inherent about allergic risk in children that should put them at higher risk for an allergic response to any of these vaccines, but we just won't know for sure until the vaccines are being tested in children.
For sure. Okay. All right. Dr. Moffitt, thank you so much for your time. We really appreciate it. Happy holidays.
You too. Thanks for having me.